My name's Michael Moore. I was a part-time GP and a part-time medical administrator up until about a year ago. And for the last year, I've been a full-time medical administrator. I was CEO of the Central Sydney Division of General Practice for 10 years. Then I was the CEO of the Inner West Sydney Medicare Local for 3 years, remember them? And I've been the CEO of the Central and Eastern Sydney PHN since its founding in 2015. Mary's GP in Wellington had never seen Mary before, and based on a short history and a quick examination, the results of some tests and what he knows, he's going to make some pretty important decisions about the management of her asthma and subsequent diabetes, and give Mary some advice, all of which is going to affect Mary's life quite profoundly. Now, making decisions based on incomplete data sets is part of the territory for health practitioners, but there's a couple of innovations, disruptions if you like, that are going to allow all of us, health practitioners, to access more information and potentially allow us to make safer, higher quality decisions. From where I sit, there's two particular innovations, disruptions if you like, affecting not just GPs but also the specialists that they refer to. They both work off the general principle that if you give smart people good information, they make great decisions. There are two internet-based technologies that are rolling out right now that as specialist physicians you should consider embracing. It's really hard to cough with these things, isn't it? Both innovations have the potential to change the way you and your referring GPs practice medicine, and by supporting good clinical decision-making, they have the potential to reduce the risk for your patients, improve continuity of care, improve quality and safety, and decrease the risk of adverse events. So the two innovations, and you've heard of them, is Health Pathways, and the second one is the My Health Record system. So Health Pathways is currently on the rise. It's an online health information portal. It's for GPs primarily, but also for specialists, junior hospital doctors, nurses, and community and allied health practitioners. It's like an online RMO handbook for everyone. Pathways are currently being written by local GPs with input from local specialists. It's an evolving technology. Pathways provide clear, concise information for medical and allied health practitioners on how to assess and manage more than 500 medical conditions and how to refer patients to local specialists and local services, including local referral criteria and local contact information. The sites are dynamic, with new pathways being constantly added, new pathways constantly under development, and existing pathways are now starting to be reviewed in light of changing evidence, technology, and local circumstances. They're not designed for the general public, and they require a password to access. And they're being written right now. If you don't have a password, you should consider contacting your local site to get one so you can look at them. At the very least, you should be aware of what pathways already exist in your local area. There may or may not be localised pathways that relate to your specialty. If there are pathways that relate to your specialty, you should look at them and critique them. They are all new, so they are eminently worthy of critique. Look at them, critique them, and pass on your feedback. Every Health Pathways page has a feedback button, and they invite your feedback. If there are no local pathways for your specialty, contact the local pathways team and ask them why not. And if you're feeling enthusiastic, you may even want to volunteer to provide input into their development. So look at your Health Pathways site. Your referring GPs are going to be increasingly using Health Pathways, and you need to know at the very least what they're reading. The second disruptive innovation that is rolling over us is the My Health Record system. Look, it's being rolled out by the Commonwealth Government, and so people take a step back and say, well, maybe it's not going to be that good, but actually it is going to be good. By the end of 2018, a My Health Record will be created for every Australian unless they choose not to have one. If you have access to the My Health Record system, you, as a specialist, right now, can already access information about your patients, such as their MBS and PBS history and their medication dispensing. So you can look at every medication you wrote a prescription, was it dispensed? You can check that on the My Health Record system. Increasingly, public hospitals are putting hospital discharge summaries up into the My Health Record system. Investigation results will soon be going up. Shared health summaries are being put up by GPs in some cases, and increasingly so. Event summaries, advanced care plans, management plans for patients increasingly are going to start going up. This is evolving technology. It's not there now, but over the next couple of years, it's going to take off. If you as a specialist have compliant software, you will be able to upload your information about your patients, which can then be viewed by hospitals and other healthcare providers involved in the care of that patient. Access to this growing source of health history information helps other people involved in the patient's treatment make more informed choices. So the My Health Record system improves better clinical decision making, better continuity of care, it reduces the risk for patients, and it decreases the risk of adverse events. Now, if your practice is not able to access the My Health Record system, the simplest thing for you to do is, well, Google it and find out what you need to do. The second thing you could do is contact your local primary health network. Get your practice manager to contact the local primary health network and find out what you need to do to access it. Primary health networks are primarily for primary care, so that's GPs and allied practitioners, but for in the e-health frame, we also have a role in looking after specialist practices as well. Now, the thing that I need to let you know about the My Health Record system is that it doesn't replace secure messaging. Secure messaging and My Health Record system are related but different. And I'll give you an example of how they're different. One thing Mary didn't tell you about was that she had a fall, and she had a fall after a binge drinking episode, and so she was a bit embarrassed about it. It happened in Dubbo. They took her to base hospital there, and she'd had falls in the past, and because it was a bad one and she lost consciousness, they did a CT of her brain, and lo and behold, they found evidence of past falls. There was a small subdural hematoma. They kept her in for observation, didn't need to do anything, but they wanted her local GP to do a follow-up CT in about a month's time to see what was going on. So they gave her a discharge summary, which they put into her hand. They didn't send anything to the local GP because they thought, well, she'll just take it. Now, if you put something up in the My Health Record system, it's the same as putting the record in the patient's hand. You don't check every patient's My Health Record system every day, and why would you? Your referring GPs don't check that every day, and why would they? So if you have some acute information that needs to be processed, it's still best to use the secure messaging system. Now, Kate went back to Wellington, and she was a bit embarrassed about falling over when she was pissed, and so she never told the GP, and so she never got that follow-up CT. Luckily, nothing happened, but there you go. That's the difference between My Health Record system, which is a patient health record system, and secure messaging. If they had sent a secure message to that patient, to her GP, she would have been followed up. So secure messaging is used for downloading pathology results, downloading radiology results. So you might think you don't use secure messaging, but if you do those two things, you already do. It can also be used for downloading discharge summaries from hospitals. GPs mostly do this. I don't know if specialists do, but I don't think that they do. GPs can send you referrals via secure messaging, and you, and many of you would already be doing this, can send your specialist reports to GPs, allied health or other providers. The wonderful thing about secure messaging is it's fast, it's also safer, and it's also more efficient than paper. You know that it's been received by your GP, and filing at the GP's end gets done automatically and electronically. Most GPs have the capacity to receive secure messaging now, and all things being equal, they do prefer their specialists to use secure messaging. Again, if you're not using secure messaging and you want to get into that space, the simplest thing to do is to contact your local PHN, Primary Health Network, but they do look after specialists when it comes to e-health. So in summary, Mary's asthma and her diabetes and her impending subdural would almost certainly have been better managed if Mary's GP and Mary's specialists had access to Mary's My Health Record, if Mary's GP had good local guidance from a local health pathways site, and if the GP, hospital and specialists that look after Mary had all communicated quickly, safely and efficiently using secure messaging. Thank you.